Hello and welcome to Healthline 3. I'm Terry Simmons. Today we're talking with Dr. Syed Mehmood of Willis Knighton Heart and Vascular Institute, and we're talking about vein surgery. We'll be taking your calls throughout the show, and as a reminder, please make sure you're in a quiet room with your TV volume turned all the way down so we can be sure and hear your questions. The number to call is 318-219-4569, and you'll see it at the bottom of your screen throughout the show. Thank you again, Dr. Mehmood, for being here.
Terry, thank you for having me again.
Oh, it's a pleasure to see you again, as always. And I love the topic that you brought to us again, something fascinating that a lot of us probably don't know about, as you said. And you also, let's just get right to, I think you have a video for us to watch, right? Do you want to set that up and tell us what it's about?
For sure. You know, one of the diseases you can get in your vein is varicosities, and you can get, especially if you're a runner or you stand the whole day, you can have venous reflux. And this is one of my patients who I'm not going to mention her name, but she's there for you, and see what she tells you about this process. So you can go play the video.
I had a varicose vein on my leg that I've had for as long as I could remember. And once I had my baby, I realized that it was starting to get worse. And so working 40 hours a week in a hair salon, I was on my feet all day long, and so I was getting sharp pains going through my leg in that vein at the end of the day. And so I decided to call Dr. Mehmood and get them to look at it. Before I had the surgery, at the end of the day, would have to prop my feet up because I would just have sharp pains just shooting down the vein. So once I had the surgery, I haven't had any issues at all. So the procedure was a breeze, and I was back at work 2 days later, standing on my feet, and nothing felt uncomfortable, it didn't even feel like anything happened to me. I've had multiple clients say that they have varicose veins also. They didn't know who to go to or what to do about it, and I've told every one of them to please call Dr. Mehmood. The team was the best.
Okay, that's fascinating. Tell us exactly, before we talk about the symptoms and the treatments and different type of vein problems, specifically to what she had, what is the surgery that she had and what did you do?
For sure. She had greater saptis venous reflux and varicosities. What we did in there was we went and laser ablated the greater saptis vein, and then she had small mini incisions in which we took the veins out. They sometimes look like worms underneath your skin in your lower legs especially. And it's very common in people who have had babies, or they run, or they stand the whole day. So most females out there.
Yes, that's really interesting. And let's talk about, well, we're going to get to the runners again, because I think when you said that, a lot of people were, we always think as runners as being super healthy, and when something like this hits, and for that to be common in runners is really interesting. So what are the symptoms for this, first of all?
For sure. Venous disease is, it encompasses a lot of problems. The first one we're going to talk about is what Becca had, is reflux. What happens is, as you get older, the veins dilate, and one of the things you can do is wear compression stockings. If you don't wear compression stockings, and especially if you spend a lot of time standing, if you're on birth control pills, or if you had multiple pregnancies, all of those dilate up your veins, and your valves can become incompetent, which means they don't work as well, and blood refluxes, meaning it stays in your legs. What this surgery does is it gets rid of the major problem that most people have. So not only does it prevent the reflux, it also prevents you to having varicosities. So people ask me, well, if you get rid of this vein, how does blood get back from your legs? You have 3 systems. It just gets rid of one, the most common issue that most people have. So, but if some people have issues in 2 other systems too, and there are a few things we can do for that.
Okay, and you talked about compression socks. Well, we hear that a lot in people who have various symptoms for different things. What are compression socks, and what do they actually do when you wear them? They go up to the knee, right? They
can actually go up to your belly button.
Oh, they can.
But I would like to show mine, but that's okay. I wear the new ones, and I have, once the day you turn 31 is when things start breaking down, and my legs were tired, and I said, okay, what can I do? And I started wearing compression socks, and that's the only socks I have now.
Really?
It makes a big difference, for especially people like me who stand up the whole day. The way the compression stock work is, as you get older, your skin gets more lax, And especially if you're overweight or underweight, you have a lot of space. Compression socks makes the vein collapse a little bit so the valves can work. That's how it works.
Okay, and if you're perfectly, you feel perfectly healthy, you don't have any symptoms at all, but you want to do it like preventative. Is it like, say you get past your 30s maybe and you want to wear them because you like to stay healthy? Is that advisable, or should you stay away from them unless you really have a reason to wear them?
No, 100%. I think even before we do the surgery, we advise everybody wear compression socks, and only if the socks don't work do we even offer surgery. Most people, if they wear it in their 30s or when they're pregnant, it'll prevent these things from happening.
Okay, and I've heard about people wearing them on flights too, when you're traveling and you're flying and sitting. I guess, is that only because it's sitting for a long time, or is it because you're flying and the altitude or anything like that?
It's a little bit of both. Sitting a long time can cause blood to pool in your legs. Socks are good, and they are known to prevent decrease the incidence of blood clot, but doing special calf exercises that helps the blood pool back, or if you're prone to blood clots in your legs, maybe walking every half an hour, or whenever they turn the seatbelt sign off and you're allowed to walk.
Right.
All those things will help.
Okay, so it's really a good thing for balance. If you stand a lot, make sure you sit some, and if you sit a lot, make sure you get up and walk around, right? So
Absolutely.
Either one.
Yeah.
You need to pay attention.
Too much of both things is bad for you.
Right, okay. And so let's talk about who is at risk for this. We kind of touched on it during the tease. Like we talked about someone who's 65 and over. So age may be a risk factor. Pregnancy, what else?
So age of 50 actually. Age of 50 plus, morbid obesity, which means you're overweight, multiple pregnancies, family history. If your mom or your father had it, you're more prone to it. Cancer can cause you to have more varicose veins. Runners, their thing is they're losing their fat, so the veins don't have the compressibility from the fat. That's why they're more prone to it. There are multitudes of things, but these are the most common. So.
Oh, that's interesting. So another reason why we need good fat in our body. It also helps the circulation in the veins and helps with that, right?
Like Goldilocks, not too little, not too much.
Yeah, just
the perfect amount.
Just right, get it just right. Okay, and so let's talk about our spider veins, the same thing as varicose veins?
Spider veins are more superficial. They're more reticular veins, means they're very superficial. They're right underneath the skin, and that might be a sign of blood backing up. A lot of times spider veins don't progress to varicose veins, but sometimes they can. And the treatment is totally different. Like spider veins is mostly cosmesis unless it starts going to the varicose veins, and treatment for that is either you can have little micro injections that can close the veins, or you can actually have a little laser which will discolor them and break them down. So either or works.
And spider veins, do they appear in any certain area, like the face or the hands, or can
for
be
sure.
anywhere? Yeah.
Legs, nose, face, neck.
Okay, and they're kind of like what they sound like, right? They just look like little spider legs.
Yeah, it looks.
They're very thin. And
it looks like almost if you cracked your windshield. Those. That's exactly what it looks like, but it looks black underneath your skin. So.
Oh, okay. And when these injections are done, do you go to, like, is it a reference to go to a vein right there, or are the injections done right where you see the? I
would not recommend the injections. We don't. That's one of the modalities. It has a maybe 2% chance of skin necrosis. You do not want a little scar on your face. But laser works really well. The only problem with laser is every 2 years you have to have a touch-up, or every year depending on your skin type. Okay. So laser is very safe. The chance of it causing problems is much less, and that's what we do at Willis Knighton. I don't personally do it. One of my partners does.
Okay, but that is the treatment for spider veins.
That is the
laser
treatment that we recommend. Yes.
Okay. All right. So tell us a little bit more about varicose veins. Is it dangerous if they go untreated?
So most guys ignore their varicose veins, and by the time they come to me, it's much harder for me to do my work because they have so much and they're so big. Most females are much nicer, and they notice it much sooner, and they come to me sooner, so make my life a little easier.
You're welcome, doctor.
Yeah, well, thank you. Yes, varicose veins sometimes can develop clots, and sometimes the clots can cause venous obstructions of deep venous thrombosis, which is a blood clot. And sometimes the blood clot can mobilize from your legs, and if it's big enough, it can go to your lungs and stop your blood flow. So it can be a major problem.
Okay. Well, we have Don on the line for you. Don, thanks for calling. What's your question for the doctor?
Sure, you were speaking about compression socks. Do you have a recommendation? I wonder if you could say, give a recommendation of a particular brand, and how would you choose a size for your body type, and where would one purchase these? If it be purchased on the internet or locally?
Oh, sure. You're talking about compression stockings?
Yes.
Okay, sure. You know, you can actually go to Walmart. They're $12, $15. They're usually 10 or 15. If they don't work, you can actually go to Line Pharmacy, and they have specially made, tailor-made ones too. So if you want your insurance to pay for it, then you have to go to a physician. He has to write your script. But compression stockings are available over the counter. The recommendations of the ones I get are usually 10 to 15 millimeter compression, and that's what I wear. I get mine from Amazon, just because I get the same brand every time. So even if my wife loses a pair, I got an extra of the same kind. So
You said 10 to 15 millimeter compression?
yes, sir.
And how would you know what size to get? I mean, does it go by like your foot size, or in the height? How far would you want it to go up?
So if you go over there, it'll tell you what your foot size is. Either it's medium, large, extra large, or excess large. It depends on the diameter or how big your calf is. That's one way to do it. But what I would do is I would just go there, have a measuring tape there, and some of them require you to measure how big your calf is. Some of them you can do by your height or your foot size. They're all equal. But some people have really big calves, and then you have to upsize yourself.
And you said if Walmart one didn't work, what was the other place?
There's a Line Avenue Pharmacy.
Oh, okay.
Yeah, they're on Line Avenue, and they actually specialize in e-socks.
Are you able, do you feel comfortable saying, you said you get yours off the internet, what is the brand that you personally use, if you're comfortable with saying it?
Oh, I can say it. Honestly, I don't remember the name, and I buy them every 6 months when mine do. But if you really want, the best one is the ones you can get over here. I mean, if you have a chance, call 318-212-VEIN. That's Melissa, and she'll tell you exactly where to go. And if you call her, maybe in a couple of hours, I'll find exactly the brand I use, and I'll tell her.
Okay, great. Thank you, sir.
You're welcome. Thank you for calling, Don.
Yes, sir.
And those were some really good questions, because I know a lot of people go in and you don't really know what size to get, even if you're looking at it. But that's a good point. Take a tape measure with you, right?
For
Just
sure.
in case you need to measure. Okay, and we have Gladys on the line. Gladys, thank you for calling. What's your question?
Yes, I have varicose veins in both legs, and I was wondering, are they doing any kind of a surgery for varicose veins?
Oh,
I also have a spider vein.
We do surgery for both. Unfortunately, your insurance will not pay for spider veins, but they will pay for varicose veins and reflux. But for us to qualify you for surgery, we have to work you up. So what I would do is call 318-212-VEIN. Talk to Melissa. She'll get you set up, and we'll see what we can do for you.
Okay. Now, in the past years ago, they was doing something called vein stripping or something like that, and I heard recently they do something like laser surgery for varicose veins. Is that true?
Yes, ma'am. That's what I do. And I don't know if you saw the start of the show. That lady Becca had laser surgery too. So.
No, I didn't see the beginning of it. But
Yeah, no
if
problem.
If I call your office, they can give me more information.
Oh, for sure. 212-VEIN.
All right, then. Thank you, sir.
You're welcome.
It really is. This is just a really good example. I think that a lot of people have varicose veins, spider veins, all kinds of things going on in their legs that they look at it and think, well, that's just the way it is. I just have that. But it can be lasered. It can be fixed. Come to you and see if they can fix it.
For sure.
Yeah. And probably we don't realize, I'm glad we're doing this show, because one of the things we like to highlight on Healthline 3 is just how dangerous something might be. Not to alert anybody, but to inform everyone that we think it's nothing, and it might be something, just ask about it.
Oh, for sure.
Yeah.
Any questions, thank you for Dr. Google. People Google a lot of things now, but you're most welcome to call us, and we'll answer any and all your questions.
Yeah. And how do you feel about people Googling and doing the research they can? If they get all the information and then bring it to you, is that good? So that way, it kind of almost a head start. Like, I got all this information, lay it out and tell me, doctor, what applies to me specifically.
So a lot of times, don't believe everything you see on the internet.
Right.
It's distorted, it's misinformation, but it's always good to have some knowledge. WebMD, there's certain physician websites, the Mayo Clinic, the Cleveland Clinic, that are centralized, that actually have good information, but a lot of people have just not correct information out there. But information is always good. If you come informed, that's better for me. I have less things to explain to you, but if you're not, we will do what we can to make it easy for you to understand what you need and what you have.
Yeah, if nothing else, I think doing the research, it might prompt the right questions to ask. Maybe not the information to go on, but just like, oh, well, I'm going to ask about that, because some people don't know what they don't know. And you can very easily leave a doctor's appointment feeling like you didn't really get your questions answered, but you didn't really know what to ask. So is that helpful in just like doing your research, but knowing what to ask and confirm with the doctor first?
Oh, for sure. It's good to know, and it's good to know what to ask for. So.
Mm-hmm. Okay, so tell us a little bit about, you touched on laser ablation. What does the word ablation mean?
Ablation means to collapse. The way the laser works, it actually causes steam to form in your blood, and the steam makes the vein collapse, and it will make the vein. So in the old days, you might ask me, why don't we just take the vein out? Well, it hurts a lot more, bleeds a lot more, but leaving it in, it makes it easier for you to treat it with less pains and has better results.
So you collapse it but leave it in.
Mm-hmm.
And then do you recirculate the blood flow? How does it, or does you?
So you were born with 3 different circulation systems. We routinely, when I do open heart surgery, I harvest the same kind of veins for my open heart, and it's just an extra conduit you were born with. It's not really important in adults as much, but it is one of your 3 systems that's spare. We only take it out when we need it for surgery or if it's causing you issues.
Okay, and you touched on earlier, I wanted to ask you about this, that you talked about how the venous system has been kind of one that's either not talked about very much or kind of neglected as far as one of the systems as of late. Why is that, and what has happened to make it more prominent?
Well, I think the biggest issues we've had in circulations, Heart and Vascular Institute, it has 2 sides. One is the arterial, which gets the blood from your heart to your legs, to your arms, to your brain, and the other is venous, which is the drainage back. The arterial system, a problem in that is very apparent. You have pain, you have ulcers, it hurts. But venous system can be more insidious, means it's there, it is causing an issue, but it takes years for it to actually develop to a point that it's hurting you. Unfortunately, by the time it causes the end result or the end sequela, which is venous ulcers, is too late. So we need to catch it sooner. It's been neglected because it's not in the forefront, but it is really important part of the circulation.
Oh yes, I can imagine. And is venous insufficiency different than what we've been talking about?
No, venous insufficiency, it can happen anywhere in your body, but varicose veins are caused by usually venous insufficiency.
Okay. And what about lymphedema? We hear that term. Can you tell us about that?
Sure. Lymphedema is another reason for you to have leg swelling. It is usually when your lymphatics, which is another system that absorbs all the excess fluid in your legs, are blocked. That could be something that masks itself like varicose veins or DVT, but it's totally different.
Okay.
And only a physician will be able to tell you that.
And we hear a lot about lymph nodes and our lymph system. What's the purpose of our lymph system? What does it do?
It's part of your immune response. So again, imagine arterial system is pushing it out, venous is taking it back, but in between this, what we call capillaries, when the blood goes through it, it forces the fluid out, and then the lymphatics drain all the fluid back. So if especially if you have had radiation to your arm, you can get lymphedema, and I'm sure you've seen some females usually with these socks that they wear for lymphedema. It's because the artery venous system is intact, but the lymphatics are blocked because of the radiation that you burned. That's where most cancer cells travel to. So it's immune. That's the reason for your lymph nodes, the immune system.
Okay. And is there different treatments for lymphedema?
Yes, lymphedema, unfortunately there are no surgeries you can do. You have to wear a compression stocking, and sometimes with time it just improves itself. Your body reforms new channels, but very little we can do with that.
And what about deep vein thrombosis, that term?
Well, we touched about a little bit before. Varicosities can sometimes have clots, and the clots can progress on and cause deep venous thrombosis, although that's rare. Deep venous thrombosis is the veins, is what we talked about. If you have had multiple pregnancies, if you have cancer, which makes you hypercoagulable, which means that you are forming more blood clots in your veins, or if you are over age of 65, if you're traveling on a plane, all these things can cause you issues and can cause you to have blood clots. And sometimes the blood clots can travel from your legs and go to your heart, and sometimes that can if they're big enough, they can stop the circulation. Some people can die from it, but there are a few treatments we can do for it. So.
Okay. And is that what a pulmonary embolism is, or is that different?
It is. It is what a pulmonary embolism is.
Okay. And if a blood clot goes to your heart, is that done? Is it fatal?
It
every
can
time?
be. If it's big enough, it can actually stop the circulation. There are a few medicines we can use. So, the treatment we've been doing, and it came about like 6-7 years ago, you can put these little catheters in there, they vibrate and they dissolve the clot. The other thing you can do is you can actually go suck out the clot too, which is a little more invasive, and both those treatment options are offered in Willis Knighton. I started the pulmonary embolism program at Willis Knighton almost 6 years ago. For years we would get it was me solely, and we would get referrals from all over, from Texarkana to Monroe to Ruston to Alexandria. Now most of these places have their own programs, just because it's a lifesaver. Time is money, time is this. So it's come a long way in the last 6 years.
6 years, and you started it on your own. Was it immediate, or what did you see right away, and how has it grown slowly, or did it just like explode because you were here and here it is?
It exploded. Now it's slowing down because everybody has their own, but that's okay. I only get the referrals or consults when most people can't fix anything. That's when they call me, so which is fine.
Yeah.
But even in our system, there are like 6 physicians doing it. From 1 to 6 makes my life a lot easier.
Easier, yes. And what have you seen? I'm sure you have learned and seen so much over these 6 years, and the procedures, the treatments, what's the biggest development that you've noticed?
I think old-fashioned surgery, and I'm a surgeon, is still there, but things are going more and more towards the minimally invasive or the less invasive things, and it's been better for the physicians as well as the patients. So, give you an example of PEs or DVTs. 6 years ago, we hardly treated most of them. Now, if we get called and they meet criteria, we try to treat all of them, because we have realized if you didn't 5-10 years down the road, they developed a lot of problems. And same thing with heart surgery. We have gone more minimally invasive, even with endovascular aneurysms. It's just been last 5-10 years. There's been a lot of changes, and a lot of changes are coming because we know what is being developed. Most things that are being developed are less invasive.
So you see it growing going forward too. Do you have kind of a vision on where it's going as it's changing? And
well, my aim would always be is if you take a pill and cures everything. That's the ultimate goal, but I don't think we are anywhere close to that. So I see it becoming more. You go home sooner. You don't have to stay in the hospital longer. Smaller cuts, less trauma to your body. Although the way we fix is not perfect, it's still better than having anything split open and trying to recover from that.
Yeah, and this is already the case. The reason for the minimally invasive surgery, that's the biggest benefit, right? Quicker recovery, you go home
for
sooner.
Sure.
And what are some, for people who don't really know the term of minimally invasive, what are some examples of it, and what does it really mean now as opposed to, like you said, old-fashioned surgery?
So one of the surgeries we can do is called the aortic valve. It sits right above your heart. 10 years ago, there was only one way. You had to split somebody's chest open, or sometimes go from the side, put you on bypass, stop your heart, stop everything, and then make a little cut on your aorta, and then take the valve out, put another one in. You have to suture it, and we still do that for young people. But most people now, you just go in from your groin. You have this procedure, awake, you go home the next day. It's become very easy, and we have done this in 99-year-olds. I would not try to do open heart surgery in 99-year-old, but a TAVR, which is called a percutaneous valves, that's the treatment of choice.
Which is a really good point. We'll talk to you about that in a minute too, but I think we have a caller. Michelle, thank you for calling. What is your question for the doctor?
Yes, I was calling because I've had a lot of pain in the back of my right knee area, and I don't feel like a lump or anything in there, but there's been like a lot of pain, and I have like a negative Homan sign.
Mm-hmm.
So should I be really concerned about like a DVT, or should I have that checked out?
We always recommend, if you're worried about something, to get it checked out. Negative Homan sign is a medical terms. It means that when you dorsiflex your feet, it doesn't hurt your calf, but it's not a perfect way. So especially if you have swelling, if there's any concern, I would go talk to your primary care or go to urgent care, and they can help evaluate you. Noise behind your knee, or you feeling like a crunch or something, usually that does not mean DVT. DVT usually is a lot of leg swelling. You can't even, most people have, it's almost twice the size, and the leg is really tense usually. But if you have any questions, I would recommend going to a physician.
Okay. Thank you.
You're welcome. Thank you for calling.
Yes, thank you so much for calling. And so one of the things we'd like to emphasize here so much, and Michelle, thank you so much for calling, is that to ask questions just like she did. Don't be afraid to ask. If anything, we're always afraid we're going to ask a silly question, or it's not going to be covered because we just wanted a visit. But do you encourage, there's no questions like that, just to come in and ask?
Oh, but there's no
anything.
silly questions, and we are here to answer anything and everything you need. Mm-hmm. As long as it's in my purview. Sometimes people say a physician gives these lawyer answers. We give these lawyer answers because we want to make sure we're not doing you any harm. And sometimes, a lot of times, I can't give you an opinion until I see you and look at your tests.
Right. And just keep asking till we're satisfied with what we're asking, right? Don't
sure.
be afraid that you're taking up too much time, or you're going to go away. You don't want to bother the doctor. If something just doesn't feel right, ask.
For sure. Let us know, and we'll tell you if you should be worried about it.
Okay.
That's our job.
And if we come in and ask you something and it doesn't really fall in your field, that's when you can recommend us to someone else too. Because sometimes we'll think, I'm going to the whole wrong doctor, he doesn't even do this. But if you're our doctor and someone we want to ask, then you can refer us to someone else.
For sure.
Don't be afraid.
That's, we try. And, one good thing I'll tell you, I'm going to give us another plug. 318-212 vein. Melissa is our vein coordinator. She's an RN. She knows, and we were just joking about it today. 1/3 of the phone calls we get have nothing to do with venous disease, but we try to help them out. And she's a superstar. We get calls from all the way from Tennessee. There was one coming from Alexandria, one from New Orleans. I don't know how they found our number. We try.
That is really good to know, and what I like all of our viewers to hear, because we do have such a widespread viewership. This reaches a lot of people in a lot of different areas, and sometimes we don't know even where to start. Back in the day, we looked in the yellow pages, we just picked something up. But if you just don't know where to start, then call your office. It's really nice to know what a nice resource your office is, just to call and ask the question and send us somewhere.
For sure.
Yeah. What's one thing that you'd like everyone to know is watching about vein surgery and the topic that we've discussed today?
I think the most important thing is when you go on a flight, especially if you're prone to have blood clots, wear compression stockings and exercise your calves. There are things you can get off the internet, walk every half an hour. If you're going on a long drive, it's the same thing. Every hour or two, get off, get a cup of coffee, walk around. That gets your concentration back and also prevents blood clots.
All right. set an alarm on your phone or your watch, get up and say if we do it every hour, it's not a big walk, so just get up and move around for a few minutes, right?
Absolutely right.
Okay. And you want to give your phone number out again for your office?
318-212-VEIN.
Okay.
Call anytime, please. Thank you.
All right, and you can go to ktbs.com/Healthline3 to find out more too. And we really enjoyed having you here today. Thank you again, Dr. Mehmood.
Thank you for
And
having
everyone,
me.
thank you for
Appreciate
watching. We'll see you next time on Healthline 3.